It's Dr. Pam. I am here for Wellness Wednesday. I apologize, I am a bit late today. But today I am going to talk about 5 times to avoid the ER. So hopefully someone will come in and join me, but if not, then I welcome those of you who come in later on. So, if you don't know me, I am Dr. Pam Middleton, your virtual holistic pediatrician. Through my concierge, telemedicine, and consultative services, I help families achieve and maintain health and wellness through inside-out healing. And I now have a special Facebook group that you can join if you go to www.theholistichuddle.com. And there you will get more information about how to keep your children healthy naturally. And it looks like somebody has joined me, but I can't tell who it is. So I'm going to go on and get started with the 5 times to avoid the ER. And the reason I'm talking about this today is because I'm seeing a lot of children in the office right now. There are a lot of viral things going around. And some of these children are following up from the ER. So they have gone to the ER and spent time waiting there, possibly expose themselves to more serious things for no reason, really. So let's go through the 5 times that you should avoid the ER for your child or for yourself. Okay, if you have a child who is older than 3 months of age and has a fever for less than 2 days, you generally do not have to go to the ER, okay? Now, of course, if your child is lethargic, if your child's in severe pain or anything like that, but just a fever for less than 2 days, because what happens, the body generally needs about 2 days in order to show us what's really going on. So if your child developed a fever, say last night, and you run to the ER early this morning, chances are they're not going to see anything at that point, and they're probably just going to tell you it's probably viral. And so you don't want to spend time there in that environment when you don't need to. Now, for all of these things, I will say each of these you can actually just call your doctor, but I'll talk about that later. Now, second time to avoid the ER is if your child has cold symptoms without shortness of breath. So, your child just has like a runny nose and a cough for 2 or 3 days. That's really not a reason to go to the ER, because they're going to tell you that your child has a cold and there's nothing that they can do. And then you're going to be upset because you spent 5 hours in the ER and nobody gave you any antibiotics, because your child did not need antibiotics if your child only has a cold. Okay? So, reason number 3 to stay out of the ER. Diarrhea for, say, less than a couple of days. That's really not that severe. Your child does not need to go to the ER for that. Reason number 4 not to go to the ER. Vomiting for less than 2 days when your child is really not that sick. Now, for all of these things, I would say that, you can follow up with your doctor. Now, the 5th reason, the 5th time, and it kind of encompasses everything that I just said, was for non-emergent issues. Remember, the emergency room is really for emergencies, not because, I'm worried about my child and I can't get him into the doctor in the next 30 minutes, so we're just going to go to the ER, okay? Because I know that that's what a lot of parents do. So, hi Renee, how are you? So, non-emergent issues that can be addressed by your regular doctor. So, call your doctor's office, and in some cases, if you can't get in touch, like let's say it's after hours, a lot of times there is a nurse service, like a nurse triage service that you can talk to, and they too can advise you as to whether what's going on with your child is severe enough that you actually need to go to an emergency room or even to urgent care. So I would say that if it's something that's really non-emergent, but you're concerned and you can't get into your doctor's office, then go to an urgent care and not necessarily an emergency room. Because what's happening now is that when children or even grown people who are really not sick going to the emergency room, you're taking up resources that can be used on people who are really sick with emergency issues. So you really don't want to do that. In a lot of cases, like I stated earlier, people get upset because they go to the emergency room, they spend hours there, and then they don't get, what they thought that they should get because they were playing Dr. Google and went online and diagnosed themselves and decided, hey, I got this, so let me go in and get this medication for it. Okay, so don't do that. Don't do that. All right. So remember that a lot of these things that I just talked about can be addressed by your regular doctor. And of course, when in doubt, that's where you're supposed to go, to your regular doctor. So if you are a parent of a young child, you should have a regular doctor for reasons like this. Because I do know that there are some people who really, for whatever reason, may not have a regular doctor, and then you're really in a bind when your child does get sick, especially if it's after hours. So you want to always establish some type of relationship with a primary care provider, practitioner, and so that when something goes on, you have someone that you can speak to who can advise you as to what you need to do. So it's fine if you call your doctor's office and they cannot get you in and they think that it's urgent enough, they may send you to an urgent care. But, try to have your doctor's office help you to make these decisions, because I'm seeing follow-ups from ERs for children who never should have gone to the ER in the first place. And now the parents are upset because they spent all this time there. And also, remember, when you take your child to an ER, you're sitting there for hours exposing them to a lot of different things. So it's really best to stay out of the ER unless you absolutely need to be there. So with that, I am going to say goodbye. You can probably tell I'm out here in California. Yes, I have on short sleeves because it's really nice here. But we would like it to actually be a bit colder and to maybe have some type of precipitation so that the fires will not be as bad as they are. So, it's not all roses out here with our warm weather, because we're having some bad things happening because of this warm weather. But I am enjoying it. Hi. Hi. Okay. So a little one is talking to me and she is not in the ER. Yay. But anyway, remember, I am Dr. Pam Middleton, your virtual holistic pediatrician. Through my concierge services, telemedicine services, and consultative services, I help families achieve and maintain health and wellness through inside-out healing. And be sure that if you want to get more information about natural healing for children, to join my Facebook group, you can go to www.theholistichuddle.com. Looking forward to seeing you in the huddle. Have a lovely rest of your Wellness Wednesday. Bye-bye.